by health service delivery area. So updated on the left is the cumulative totals since the pandemic started last year, and on the right, the past 7 days. And as we can see from this, we have had ongoing transmission in areas that have not previously been heavily affected in British Columbia, particularly in the north and the interior of BC. And as we have had more cases, we have presented data at a more granular level, and this is the data, the geographic distribution of our cases by local health area of residence. And by convention, we always present the data by where people live, and that's what we have done from the beginning, and of course across Canada we do that the same way. So that does not always reflect where people have been exposed to the virus or become infected. But by local health area, now that we have increased numbers of cases in our local health areas, we can present this data more frequently without risking re-identification of individuals. This tells us that there has been no area of the province that has been spared from this virus. And in the last 2 weeks, we have seen spread, particularly in areas that have not yet seen such spread in communities in the interior and the north in particular. And on a positive note, we've seen decreased activity in some of the hard-hit areas early on, particularly in the Fraser Health region in the Surrey area. This is the profile of our cases over the last couple of weeks. We've had 3,000 new cases this week and 108 people newly hospitalized. As you can see, our epidemic curve increased and peaked in November. It has come down. We did see a bit of a blip again early in January related to transmission over the holidays. And we've now flattened and slowly started to decrease. This is the same information presented by the data of the lab Pascal report, and it goes back only to the summer, but it shows the progress that we've had in our second wave of the pandemic here in British Columbia. Again, the majority of cases happen in the Fraser Health region, but what we've seen more recently is a steady decreasing in Fraser Health, which is really great news, but an increasing in some of the other health authorities, particularly the interior and the north, and also what we're seeing in Vancouver Coastal most recently has also increased, and that is we're seeing more cases in areas like Whistler and in the North Shore Coast Garibaldi region of Vancouver Coastal Health. As I mentioned last week, we have plateaued. We've started to slowly decrease again, and that is important for us, and we'll pay more attention to that in the coming slides. This is the epidemic curve by episode date. So that's by when the date of onset of illness for people. So that gives us a better idea of the time frame when people are getting infected. And we can see from this slide that we continue to have the majority of our cases are people that we can link to a known case, cluster, or outbreak in our community. And about 20% of cases still we are unable to find the link to their exposures. And we've been watching that quite closely. During the peak in November, we had challenges keeping up with contact tracing across British Columbia. We are now doing much better at that as cases have come down, but it has been a strain, particularly in areas where we have fewer resources in areas in the north and the interior health region, for example. We still have some cases related to international travel, and that, of course, is most concerning in these past few months. As we've identified variants of concern, we're calling them, that have come from parts of the world, and these variants have led to increased transmission in some areas of the world. We see that in the UK, in places like Portugal and Ireland. So it is very concerning for us that we manage and prevent repeated importations of these types of variants.
这些病毒来变异。
This is the epidemic curve broken down by different age groups.
这个是
We can
根据年龄
see
来
very
看到
easily
吗
that the
？20到
top age
29岁
group, the
还是
20 to
最高的。他
29-year-olds,
说大家可以看看，
is really
始终是在
continues to be
它还是在
the most
最高的，
frequent
永远是最高的。
age of
那么0
transmission,
到9岁呢
and
还是
people
最
who
小
are
的。
coming infected with
80岁以上的
COVID-19.
黑色
We
的
did
也
see
是
a
很少，
decrease, a
但
steady
是他
decrease
们
leading
的
up to the Christmas break,
那么
but
说
then
这个
a
圣诞
rapid
节以后呢
increase
是
again
的确是
related
慢慢下降了。
primarily to social events that were happening
大
over
家可以
that
看到
break.
20岁到
We
29岁
also
，30
see
到
that
39
it's
岁，40到
people
49 岁
between the
这3
ages
条
of
曲线
20
只
and
会是最高
49
的。
which are driving the
接下来
pandemic
是
at this
10到
point.
19岁，
And
反而
we-
60到
we've,
69、
from
70
the
到
data that we
79
have on the
慢慢
ground
慢
from
下降。
public health, we see that there's two different areas where we're
这个
seeing
是7
transmission
天的
events happening.
走势。
One is in social gatherings and interactions, and that tends to be in the younger age group. But then we're also seeing workplace transmission and sometimes quite large
还有
outbreaks
呢
in
就是可能
workplaces,
主要
but
是
transmission events
那
in
个
the
工作场
older
所获得
working
的，
age
这个也是
category.
要
The
大
things
家引
that
起
are
足够重
important
视
to
的。
note on this is that we have seen again low rates of transmission in the 10 to 19 and the 0 to 9-year age
那么
groups,
0到9
and
岁
those have come
10到
down. There
19
was a
岁呢
peak
他们
after
的
the winter break where there was transmission
寒假结束
likely
以后
related
呢
to social
慢慢下
events
降了。
over
那么这
the
个也是
Christmas
跟他们
break
这
or the
个
winter break.
那个
But
他
we're
们
now
的
seeing
传播
once
率也
schools are
很低。
back in place that
那
transmission
么
rates are
从
going
这
down
个
again.
看到了，他
And
说
really
寒假的时候就
importantly,
往下走，
we are
然
finally
后寒
seeing
假
a
结束呢又开始
concerted
往上走
and
了。
a continuous decrease in transmission and cases in people over age 80. And that is
所
very
以他说这
gratifying for
个
us as
80 岁
it
以
reflects
上的
the
真的
protection
是
that we've been
虽
able to
然这个
provide people primarily in
绝对
long-term
数
care
字少。
homes from the immunization program that started in December. This
那么
is
但是他说
looking
12月
at
份以后
our
呢，
case
这个
rates
因
and
为开始施
testing
打疫苗了，所以
BC
也是
overall
下
and
降
by
了。
different health authorities.
那么
And
这
just
个呢
quickly to
是
say that the
每个卫
background
生
gray
局的
shadows
趋
gives
势
us a，
大家
sense
可以
of how
看到
many
了，延
tests
安
are
卫生
done per
局
day.
中
And
了
then
高峰之后
the
开始
colored
显著
line
下降。
is the percent
那
positivity
么
in a rolling
飞
average.
沙还没说
The good
哦
news on this slide is that we've seen a steady
飞沙
decrease
我
in,
看
in
没
both
没飞
testing
沙哦，飞沙对
percent
第二个
positivity
是
and
飞沙
numbers of
显著
cases
的
in
往
the
下走
Fraser Health，
大家
region.
都可以看
It
到，他
has
说这
been
个是也是可以欣慰的
lowering
看
and
到。
finally coming down again in
那么
interior health
北部
and
卫生局
Vancouver coastal
北部卫生
with a
局
bit of
和
a
那
blip
个
here
延
in
安
the
卫生
last
局
few weeks. Most
北部
concerning
和
is
那
the
个
areas
内
that
陆
we've seen quite
这
high
个还
percent
是在往
positivities
上
in the
走的，
north,
这个趋
and
势
that
还是很
reflects
明显。
transmission in
这个
several
下降趋势
communities
不是很明
across the
显，虽然也
north.
是在下
That
降，
is now coming down, but still remains
但是虽然
relatively
是下降
high.
了，还是相对来讲高一点。
This is the same information broken down by age groups.
这个呢也
And
是跟年龄
particularly,
分布
we look
趋
at
势
this
是
to
一
help
样
us
的。
understand transmission in specific settings. And the 5 to 12-year-olds and 13
他
to
说5至到
18-year-olds, a group we
这个
watch very
年纪
carefully
轻的还是
as
要希望大家
school-age
引起
children.
格外引起
We
重
can
视。
see in the background that there's a big spike in September, and that was when a
他们
lot
说
of
是这
testing
个
of
9月份以
school-age
后
children was
因
being
为
done
根据
at
孩子
that
们
period
的
of
这
time,
个
although
测
the
试的数量多了以后
positivity，rates
他
were
们有
very
一个
low.
很上的一个趋
They have
势
come，up
但
in
是后
all
来慢
age
慢又开始
groups
下降
as
了。
our second wave progressed,
这个也是
reflecting
看到
transmission
了
in
学
the
龄前的
community.
儿童、
But
学
we
龄
are
儿
not
童
seeing
青年。
accelerated transmission in school-age children, which is also very important, and where we're seeing that the most transmission and the highest percent positivities are in the 19 to 40-year age group, as we talked
所以
about
他说
before.
主要是
And
19
again,
到
we see a
40岁
nice,
这部年
steady,
龄还是主
finally
力。
decrease in
但是呢也是
transmission
很
rates
显著的开
and
始下降了，
with
从他
high
们的
testing
传
in
染
people
也
over
是
age
这
80.
个阳性或者也
And
是
this
下
is
降了。
a reflection of
那么这个
how
呢
our
是
healthcare
新增
system
人数
is
和
being
住院人数的
impacted
区
by
别，
our
以及重
pandemic.
症监
As
护
we。can see, the cases peaked in November, and hospitalizations, a lag indicator, peaked several weeks later
那
and
么
have
他说
now
这个住
come
院
down
和
but
每天
leveled
新
off
增的
again.
数字呢会有点
And
滞后
the same
这个也
we're
是正
seeing
常的
with deaths,
阳
which
性了，然
peaked
后慢慢
later
发展
than
成
our
重症在住
hospitalizations
院，
and
所以
the
他说住
cases.
院的高
We've
峰
now
和
seen a
新增
leveling
呢
off,
还会有
and
点滞后
we hope
那么但是
a
现在看来
steady
都是在下
decrease.
降
again, looking at both the hospital and critical care, so that's people who require ICU care, and this is our daily occupancy per million population. So that puts it in a perspective, and really what it shows us is the impact, the dramatic impact that the pandemic has been having recently on our healthcare system in the north, and that's something we've been paying a lot of attention to try and support the healthcare workers in our system, and we've had on many occasions to have to move people around who needed care to other parts of the province to support the ongoing pressures in the north. This is an update of our distribution of cases, hospitalizations, ICU, and deaths by age. We continue to see that the older we get, the more likely there is to be hospitalization, to require ICU care, and particularly people over age 70 are much more likely to die from COVID-19. And this, of course, is one of the important measures that we are using to drive our immunization program with the limited amounts of vaccine that we have right now, making sure that we can protect those people most at risk of hospitalization, of needing ICU care, and of course of dying from COVID-19 is our primary priority. Not only does that protect individuals, our seniors and elders in particular, but it also takes pressure off our healthcare system so that we're able to make sure we can provide care for everybody who needs it in the province. The other important thing that we continue to see in this that's reflected here is that people under the age, children and youth under the age of 19 and particularly under the age of 10 are still underrepresented compared to the proportion in the population, which is one of the positive things that we have out of this pandemic, reinforcing that young people are much less likely to be infected and also, thankfully, less likely to have severe illness. This is a bit of update of some of the data we have on school-age children that we've been watching carefully. Those 5 to 12 and 13 to 18, as I mentioned, particularly the 5 to 12, the young children, underrepresented in the number of cases that we've seen across the province. And this reflects what we've seen around the world, across Canada as well, that school-age children are less likely to be infected, less likely to get sick from COVID-19. To put that in perspective for us here in BC, the top line here, the red line, is cases in all ages, and we can see that school-age children are underrepresented, still less than 10% of our cases overall, and we see a decrease in cases once school is starting, and reflecting really transmission in the community. I'll go quickly through these. These are just comparisons again of our case rates in British Columbia compared to other jurisdictions in Canada, and this is the death rates that we've been seeing in British Columbia compared to other jurisdictions in Canada and internationally. We can see that around the world people have experienced varying degrees of severity in our second waves, but that across the board things are starting to settle down. And despite the concerns that we're seeing with the rapid increase in some countries, the UK in particular, France, Portugal, Ireland, related to more infected variants that have arisen in the last few months. This, again, being a lag indicator, taking some time before it shows up the daily death rates compared to other populations. Very concerning, of course, is that some of these new variants have now been associated with increased severity of illness, and that is very worrisome. So all of that data goes into helping us understand the trajectory of our pandemic here in BC and where we are in terms of the potential for rapid takeoff or growth of the pandemic again. And this is the reproductive number, the average daily number of new infections per case. And this is a composite number that helps us understand where we are in terms of how many people every case is transmitting to. But we do know from this virus that
从
that
1月
this
份
is
以
an
后又开始
average,
第
and the
1了。
majority of people who are infected don't transmit to
这也是
anybody.
就是说
But some
有一
people
个人传了，有些人不
have what we
传，
call
有些人
are
就是
involved in
他
what
有
we
阳
call
性，但
super
是他没
spreader
传，
events,
有些
where
人
a
他
person can
获得了，
transmit
但是
to
他传
many
2个，
others.
所以这
So
个就
when we
是
look
他
at an
说
average, we
一个
have
人
to
传几
remember
个，有
that
些人没
it
传
doesn't always
那
reflect
么他也是
the
说的，就
potential
是
of
这个
each
呢，就是表
individual.
明了我
But
们
the
这
good
个
news here
但
is
所以这个是好消息，数字声音又有
at
了，
or
大家可以
above
看到
for
了。
much of the last few months.
那在过
In
去
the
的几
last
个月
couple
里
of
边
weeks, we've
我
seen
们在
that
过去
curve
的几
bend
个星期
down
呢，我们
again.
把这个曲线拉下来了。
And now that we've had the number of cases we have, we can look at this in more granular way across the province.
这个是
The numbers
每
are
个卫
more
生局下
stable.
面的
The higher the cases, the higher the population. So really, when we look at Fraser Health, we see
大家
that
看
it's
到了，又
nicely
是
come
费
down
沙
under
又
1.
真的是往下走
Vancouver
了，
Coastal
不是
Health
低
has
于
been
1了。
hovering around 1, and that's primarily related to
这
some of
个
the transmission
沿岸也
events
是
and
差不
the
多1左
ongoing
右。那
transmission
么岛
concerns
上是
in
高于
places like
1，
Whistler and other
内
parts
陆
of
开始下
the
降
North Shore, Coast
北部
Garibaldi
又有
area
一
of
点上
Vancouver
升。
Coastal. The interior, where we've seen clusters in a number
那
of
么他说内陆
communities
呢，
take
我们
off
看
quite
到了零星
rapidly,
的在社区里
seems
边
to
在
be
快速的
settling
传
down
播。
now,
那么
and the
现在呢，慢
reproductive
慢
number
下
again
降
has
走了
come down
所
below
以这个也
1,
是
and we've
低于
seen that
1
as
了。
well for the north,
这个是内陆
although
那么
the
北部
numbers
呢，
are
他
small
说
here, so
也
the
是看到了
change
零
can
星
mean
的
a big
看到
difference
了
in terms of
社
stress
区的
on
感染传染。
on our communities and the healthcare system. And on Vancouver Island, we've had an
那么
increase
岛
over the
上卫
last
生局
number of
我们看到了
weeks,
快速的
but that
增
is
长
slowly coming down
现在
again.
也是慢慢下降。
This then leads into helping us understand the modeling that allows us to get a sense of what could happen
那
in
么
the
这个呢，
future,
就是
given where
将
we are
来
today
我们怎么
and
走
the history of what's happened
现
in
在
the
就是1 月
past.
份、2月
So
份、
this
3月
is
份
a
现在按
figure
照
that
现
will
在
be
这个
familiar.
严肃的
We've
趋势
updated
还是往
it,
下
and
走
we've now seen since
那个
December
他说
a
8月
steady
份的时候
decrease in
3
our
月份的时候
cases
是一天
and
新增
our
800例
transmissions
那么
over
现在
time.
都是慢慢
The
走了。
background, however, gives us a sense of the uncertainty and potential. And what we do know is that we are on a good trajectory, but it could change very quickly,
但是他
and
说
we
我
could
们
see
现在这个
rapid
趋势是
increases,
但是你只
like
要
we
一
have
放
seen
松马
in
上就
other
往上走
countries and
大
other
家可以看到
provinces
粉红
on
色
a
的
very
虚的
rapid
这个就是
period
只
of
要是
time.
我
And
们
when
一
we
放
look
松
at the
马上就
models
快速的往上走
describing
这个也
these
是各
trends
个卫生
by
局
health
下的这
authority,
个
we see
趋势
these
我们
stable or
非常卫
declining
生局
trends
还是
all
重点
across the province,
接下
which
来
is
是
good
沿岸
news. The challenge is maintaining
所以
this.
他说最
We
困难的
do
对挑
not
战的
need
还
or
是如
want
何维
to see
持
rapid
我们现在如
inflections,
何
and
维
that
持
is
是
a
最困难的
possibility based on these models. And it has to do with our interactions and making sure that our interactions continue to be safe and
所以希
prevent
望大家还是
transmission
要
of infection.
持续的
When we look at
再
the
叫大家
scenarios
再
that could
紧密一
possibly
点，大家再
happen,
坚持
should we
那么
start
现在呢就是
increasing our
看
contacts?
来了我
And
们
what we're
还
talking
是
about are
回到我
infectious
们正
contacts.
常的
That means
社交
contacts
如果
that
是正常
are
社交的
risky
40%
and may
那
allow
么
the
怎么
virus
样
to be
怎么样
transmitted from somebody who's infected to one or multiple other people. Right
那
now,
么
when
有
we
时候
look
呢
at
就
these
会一个
model
人传一个人，一
parameters,
个人传
we're
2个人
probably somewhere
如
in
果
the
我们
40
恢复
to
到
50%
正常
of
社交
our
的
infectious
70%，
contact
大家可以
rate
看到
compared
如
to
果是40
pre-pandemic.
就往下
So
走
that means that we are
维持
doing the things
60 和
that we
70
need to
都是
do
快速
to
往上走
stay apart,
所以大家
to
注意
keep
看
our safe
我相信
distances, to
今
wear
天的主
masks,
题
stay
就
away
是
from
我
others
们
when
现
we're
在
sick. These
所
are
有的
all
卫
the
生
things
措
that
施
we
不
know
会变
reduce
所有的
our
卫生禁
rate
令
of
不会变
infections,
这
reduce
个是我答
the
的今天要会
probability
宣
that
布
we're going
延
to
长还
pass the
是取
virus
消
on to
或
somebody
者放松
else if we're sick ourselves.
他也是说到了，
Where
如
we
果
have
我们生病
concerns
不舒服
is
了
that we
远离
can
人群
end up into the
不
bottom
能够保证
scenarios
距离的地
where we
方
have
就戴口
rapid
罩
growth of this virus. And we've seen
然后呢
that
尽量
happen.
就是
It can happen in a variety
local
of ways. One, it can happen by us having more social interactions or gatherings or coming into contact without the precautions in place with a large number of people. The other thing that can drive this is the new variants of concern. And we call them variants of concern because it means that they are more infectious than the virus, the strain of the virus that we've seen circulating for the most part so far in our communities. And with more infectious, it means that even if we slip a little bit, the potential for transmission goes up. And this is what is concerning for us right now. We do not need or want to be in that situation where we start to see rapid growth. And there's a couple of ways that these variants can cause concerns for us, and I'll talk about that in a minute. On our positive side, the things that are going to protect us and get us out of this pandemic is about having access to vaccination and being immunized. So far in British Columbia, we've received 156,250 doses of vaccine, both the Pfizer and the Moderna vaccine, and we've administered almost all of it. We did receive some vaccine this week from Pfizer, and we're due to receive more of the Moderna vaccine. Some of it has come already, and more of it will be coming this weekend. Our focus of the immunization program, as we know, has been particularly on protecting those most at risk, and that is our seniors, elders, and residents of long-term care. And we have done fairly well at getting first doses into the vast majority of our long-term care residents across the province, 87% based on the target, the number of residents that we know, and we'll have more detailed breakdowns of this information by care facility in the coming week. But there are some people who have not been able to receive immunization, primarily because they've been recently infected with the virus, and we've gone in to immunize in care homes where we're having outbreaks, and it has been, we're now seeing it is helping us to stop those outbreaks rapidly. However, unfortunately, some people are still in the acute phase of infection and can't be vaccinated, but we will catch them up in a few weeks. As well, some people have not had consent, but that's a very small number. Also, very importantly, is making sure that we protect the circle around those most vulnerable people in long-term care, and that's immunizing staff and people who work in care homes. And again, we've had very high uptake in most places around the province, and we'll be looking at this in more detail on a facility-by-facility basis in the coming week. We also have been focusing on people who live in our registered assisted living residents, and this is an ongoing initiative to make sure that we capture most and all of those people who are most at risk and people who are working in those settings as well. Very important part of our immunization program is making sure that we have a safety surveillance system that allows us to know every single dose by lot number and by vaccine that goes into every person's arms. This is incredibly important, particularly because these are new vaccines. And as more vaccines come online, we need to be able to monitor for safety signals. And safety signals are signals that come up when large amounts of vaccine are used in large numbers of people. And so we now have millions of people around the world. The clinical trials that were done had 40,000, 50,000 people in them, and you would expect to see any common safety concerns, but not rare events. So what we have been doing is we're part of a national and international system of monitoring for safety, and the good news is around the world, across Canada and here in BC, we have identified no new safety signals with either of the vaccines that we're using, with over 145,000 doses, as I mentioned, being administered here in BC. So we have had 205 what we call adverse events following immunization, APEs. These are written out events that we have been monitoring with all vaccines for a long time. So we know that this means people are watching very carefully for these. 14, we have approximately 14 APEs or adverse events reports for every 10,000 doses of vaccine. So that's not not unexpected. In BC, we've had 55 people who were classified as having a serious adverse event, including mostly severe allergic reactions or anaphylaxis. This is something that we've seen that came out of the clinical trials with the vaccines that we have, and we've seen around the world, and we are monitoring very carefully. It's also something that's not unexpected with a vaccine or any medication, and we have provisions with all of our immunization clinics to make sure that we can detect and care for people who have this type of reactions and treat them. And so far, everybody has recovered from these allergic reactions, and only a very small number of people have had to be in hospital for a short period of time. Importantly, there are events that can happen, particularly when we're immunizing older people, that are temporarily associated with the vaccine but are not caused by the vaccine. And we're very careful. We have what's called a causality committee that does this work in BC, across Canada, and with the WHO internationally to monitor very carefully. And so far, we have not seen any serious events caused by the vaccine. I want to finish by talking a little bit about variants of concern. These are something that have entered our lexicon in the last few weeks, particularly because of one variant that was detected in the UK to start with that was associated with increased transmissibility, rapidly increasing numbers of people being infected. And this virus is an RNA virus. That means it has a single genomic sequence, which means that every time it replicates, there's a potential for a mutation or a change to happen. I liken it to, it doesn't have a spell checker, so sometimes the genetic code can get it wrong and misspell. And that can, in some cases, lead to a virus that has some sort of ability to take over or spread faster, gives it an advantage. And this is one of the things that we've seen in the UK, that the virus variant that was detected in the UK meant that it could be transmitted more easily to others. And more worrisome, in the last week or so, there's also been some data that suggests it might cause more severe illness. Sometimes it's very difficult to tease that apart because we know the more people that are infected, the more people who are going to have serious illness. But there is some concern about that. And that is very concerning to us as well. In BC, we have been using whole genome sequencing. So that's doing the sequence of the about 30,000 base pairs that make up this virus's genetic material on an ongoing basis to help us understand how the virus is moving in our population. And it was one of the things that helped us determine early on that we were seeing an increase in people coming in from Washington State, from Europe, etc. It's how we detected the first importation of a virus that somebody had picked up in Iran. Right now, we do about 750 whole genome sequences on positive tests per week. But the BC CDC lab, as working with partners across the country, is developing a screening marker so that we can screen thousands of samples per week, hopefully get to all of the positive samples being screened for this, and then with this marker lights up, doing the whole genome sequencing on those targeted isolates, we call them, or the swabs, the virus that's being detected from cases. So right now, we are doing whole genome sequencing to look for the variants of concern that have been identified internationally. So there are many other variants out there, slight changes. As we've seen, it changes about 2 mutations per month. But these ones are concerned because, as I mentioned, they have increased transmissibility. And there's some concern that the variant from South Africa may give it some ability to the vaccine may not work as well. Some vaccines may not work as well in that variant. So this is what we have as of yesterday here in British Columbia. We've sequenced about 4,500 cases, and we've detected both either the UK or the South African variant in 28 cases. Of the UK variant, 14 of those cases were directly were people who had histories of travel directly from the UK, from Ireland, from Dubai. There's a few other countries as well. And there were 5 individuals who had this variant who were close contacts of somebody who traveled. So far, those variants seem to be relatively contained, but it is concerning to us that we continue to have transmission in our community of these variants, the UK variant in particular, and we're increasing our screening and targeting of outbreaks in other places to make sure that we are finding and containing this variant. Of concern to us is we also have 8 cases of the variant B1351, which was first detected in South Africa, that were acquired locally. And in 5 of these, we do not know where that person acquired the virus. 3 of them were contacts of somebody who had acquired the virus either from travel or locally. So this is more concerning to us. Again, we don't seem to be seeing widespread variants here in the province yet, but we are stepping up our surveillance and targeted surveillance to better understand where we are. And for those who are following, we have seen an increase. We had only a few of these detected even as early as last week, and we've now had double the number within this past week. So this is something we are watching and are of great concern. This is just a schematic to help you understand a little bit about how we use these variants, this whole genome sequencing, to understand transmission and transmission patterns. So what this shows is a phylogenetic tree. It's kind of like an ancestry tree, with the ones that are on the same line or the same fork being more closely related. So they would be brothers and sisters compared to cousins that are on a different branch of this tree. And this is all of the whole genome sequencing that we've done in BC in the last little while. And in blue, there are the small number of dots that represent these variants of concern. And finally, this is a tool, and this is a pattern that we use when we're looking at outbreaks in British Columbia. And this is the phylogenetic tree with one particular outbreak that helped us understand that it wasn't all transmission with one introduction, because we can see that there's 2 different families of virus that have been transmitted in this outbreak, and that tells us that it wasn't all from one introduction, that there was more than one person who brought that virus into that outbreak. And that is one way that we do our outbreak investigations, helps us to understand the transmission of the virus in different settings. So with that, I'm going to talk a little bit about where does that leave us now. So what this modeling and the epidemiology tells us is that we are seeing some encouraging signs here in BC. The efforts that we are all doing here in BC are working. Through our individual and collective efforts, the average number of new infections with each new case, so that reproductive number is now down below 0, below 1. And that's where we need to keep it. Since our immunization program got underway, we've seen a dramatic and sustained decrease in illness amongst our most elderly and susceptible to severe illness. And this is important and welcome news for us all. By spending less time with others, by staying local, using our layers of protection, we are bending our curve.
我们
slowly
可以
and
慢慢的
steadily.
把这个曲
But we
线拉平
need
或
to
者拉低。
protect the progress we have made
我们一定要
since
保
the
护
start
好
of
现
this
在我
year
们的成
and
果，
not
我们一定要
squander
巩
our
固
success.
今年还是
To
这样
do this,
啊
we need
所
to
以我
use
们如
this time
果还是
to
要
buy ourselves more
努力
time.
还
To
是
get
要
our immunization
不
program
断
fully
的
back on
这
track,
个
push
让我
our
们
cases down
赢得
further.
不断的赢
And
得
this
时
will
间
allow us
使
to
得我们的每
respond
天的新增案例
quickly
能
and
够下降
rapidly to any surge in
那么
variants of
如果
concern
看到
that
慢
may come
慢
up
一
very
点，只要有一
quickly.
点上升的
We
苗头，
only
我们
need
一
look
定要
around
马
us
上
to
停
see
止，
how
以及
severe
把
the
它拉
impact
下来。
can be if we don't have a buffer in our healthcare capacity.
所以我们每一
And
个
this
人
is
都自
our
己
time
给自己一个
to do that.
缓冲希望我们的
With
公卫
this
系
in
统的
mind,
资
I
源
am
一
keeping
定有
the
一个
current
安全的
province-wide public
数
health
字
orders
安
on
全的
gathering
水位
and
线。
events in place.
所以希望大家不要再
I
聚
will
集
be。
那么接下来
continually
还有什
reviewing
么一
and
些节日
reconsider the
希
need
望
for
大
these
家还
restrictions
是能够
based on
考
the
虑。
incidence
那
and
么我现
prevalence
在
of the
主要
virus,
是
the
考虑
data
到
that
目
we've shown
前的
today,
具体
any
的数
new
字。
information about transmission,
所以还是要考虑到
and
新的
the
卫生
progress of our
公卫系统的
vaccination
禁令
supply and our immunization
我们也要
program.
考虑到我们疫苗的
Right
供
now,
应
we
情
need
况。
to stay the path.
所以我们现在还是要在这个正确的，
We need to
我
buy
们还是
time
要
to
争取时间
understand how these variants of concern or whether
主要
these
是变
variants
异
of
体
concern
就是
are
给
going
我
to
们造
affect
成的
transmission in
焦
our
虑
community, and
不
we
得
need
使
to
得
buy
这个
time to get our
让我们有赢
immunization
得更多的时
program
间。
back
我
up
们是在
and
与时
running
间赛
at
跑，
full
今天
speed.
这个是新的说法。
Just one or two super spreading events
那
in
么
our
只要有
network
一两例
or
超级传
slight
染，
increase in our contacts
马上就
or
会使
risky
得
contacts
这
with
个
others can
风险就会
quickly
增加
counteract
而
all
且
of our
快速的传
progress
播
and work,
一定就会传播出来
especially。with that increasing information we have about these more transmissible variants.
特
Seeing
别是
one
这
more
些
friend
这个
having
英国
one
变异
birthday
体和
party
南非
with
变
those
异体
outside
等
our
等，
household
所以希
is
望大
all
家
that
如
it
果
may
是生
take
日
in
也
our
好，或者是
communities.
聚聚也好
And
能
communities
够在
around
室外就是在
BC
室
have
外
seen this in this last few
那我们
months.
在过去几个月里边已
Places
经
where
看
we
到
have
了
not
这个
seen
糟糕的
transmission
情况，
before,
我们不希望
social
看到社
gatherings
区
that
的在
happened
传
over
播
the， Christmas
大家的
break,
社
for
交聚
example,
集
social
特别
gatherings that
是
have happened
这
in
个圣诞
ski hills
节，
and
大
other
家已经
places
这么
have
做
led
了，
to
已经很
rapid
好
transmission
大
in
家也
some
可以看到
communities.
威斯勒那边的
We
滑
want
雪
and need
导致了快速的传
a
播
smooth,。
我们
path
是
to the
希望能
finish
够平滑
with
的
few and
拉平这个
any
曲线
hurdles
这个
like outbreaks or
所以
unchecked
我们不
transmission
需
in
要
more
看到
communities.
在这个放
We're
松的
not
情况
quite there yet,
我们还
but
没
we
有
are
远没
getting
有到
closer
这
every
个
day.
胜利的结
Each
果
holiday and occasion this
每一
month,
个节
whether
日
it's the
每
Super
今
Bowl
这
this
个月
Sunday,
特别是
Lunar
礼
New
拜
Year,
天的
Family Day,
超级晚
Valentine's Day.
接下来的
It's an
中国
important
新年以
opportunity
及
for
情
us
人
to
节
either allow the
每一
virus
个
to
人都
spread
每一个节日
or
都
to
使得
slow
病
it
毒
down
会传播
even
很
more.
容易，所以
Whether
希
we're
望大
in
家
Whistler,
还是
Revelstoke, Prince
慢慢下来
Rupert, Victoria,
大家特
the
别是
choice
下来
is ours
很多
right now
旅游胜地
to make the difference.
我所有的
We
选
all
择都在
want
我
to
们
get
手上
to the， days
希望
where
大
these
家
orders can be lifted.
能够帮助
As we
一
look
起
towards the end of this month,
那么让我
these
们共
data
同团
will
结
tell us if more action
到
is
月底我们
required
看看这个数字
or
如
if
何
we
怎
can
么样
start to ease
因为我
the
们现在
restrictions
所
we
传
have
的
in
行动
place.
都是2个
Through
礼
our
拜以后
shared
才能反
efforts,
应
and as long as
所
we
以希
continue
望我们
on
大
this
家能够
path,
共同
we
努力
can start
我们
planning for the
能够
return
持
of
续下
activities
去
at the end of this month.
那么我们也
Looking
是对
ahead,
自己
we are
的
working
行
and
为
continue
能
to
够做一
work
个好
with
的计
VIA
划
Sport,
事
and
先
we
做
can
好
start to put plans in place
所以我们
to
也是能够
get youth sport
完
up
成
and
按照
running
我们
by
的
the end of this
卫
month.
生命令执行
We
的
can start with faith services
所以
to prepare to
我
resume
们也是
services
也
with
是
full
看
plans in place
也
to
是要对
ensure
我们
everyone
的
is
之
safe.
前的努力
And
要
all
有
of
信
us
心不
can
是说
start
没
to
有效果
resume
我
some
们
of those
自暴自
important
弃
social
就是这个意思
interactions
希
in a
望大家
moderate way.
如果
Those
一定要
connections
社
that have
捐
been missing.
也是要有一
So
个
by
适
the
当
end
的
of the
方
month,
式
once again, then we can look to having
那么
our safe six, our bubble
我们希
again.
望我
The
还说
same
一
group
遍，
of
每一个
people,
人的
whether
社
that's
交
our
圈子少一
grandparents,
点
close family,
啊
or a
如果
close
是
single group of friends.
那么如果是要
Staying
见
small,
长
staying
者
local
或者
right
是
now
见
for
子
the
女啊
next
什么，还
while
是
will
要
mean
能
fewer
够少一
cases,
点
means
啊。
fewer outbreaks, means
如
fewer
果
severe
每天
illness,
新增的
fewer
少
people，
那
in
么爆发的
hospitals,
数数会
fewer
就
people
少，
dying.
就是更
These
少
are
的
the
人死
signs
亡
that I and we will be
啊。我
watching
们都已经
through
看
the
到了
hard
这些
push
现
that
象，
we have on right now to the end of this month.
所以这个
We need to
月底之
continue
前，
this
我们还是
for
要
the
坚
next
持
while.
啊，好
Today
吗？
tomorrow, this weekend,
今天、
and
明天
next,
这
so
个
we
周
can
末、
get to
下一
those
个礼拜
brighter, safer days
希望大
ahead.
家能够每天
Spring
能够
is
更安
coming.
全。
The summer is coming.
春天马上
We
来
need
了，
to
夏
get
天也
there
要来。
by minimizing the
我们一
impact
定
on
要
our communities
减少
now.
对疫情
And
对
we
我
need
们
to
社
do
区的
that
冲击。
by being kind,
所以我们
being calm,
一定要
and
就是大
staying
家
safe.
比3个be kind, be calm, and be safe 啊。好，那么卫生厅长再做一些总结。又没声音了。今天的转播不是很好，他们换地方。
By acknowledging those people who have passed away from COVID-19, the 6 people who passed away yesterday, all in the Fraser Health
那么
Authority,
昨
the
天是新增6例死
1,240
亡
people
啊。
who
那
have
么
died
他说是一共是到了
COVID-19 since
1240
the
例
beginning
了
of the
啊！
pandemic.
自从全球
This
流行病以
say
来，
will
我们
be
BC 省已经
providing
新冠
the numbers
相
for
关的死
today
亡已
later
经
today, but just to acknowledge
1240个了。
that sense of loss that communities, that caregivers,
啊，
and
这
of course
些所
families
有
have
的
felt
生
at the
命失
losses,
去
the
都
profound
是对
losses
社
that have
区
occurred during
对
this pandemic.
家庭的
And they
重大
remind
损
us as
失
well，
这个
of the
损失是
need
弥补
and
不
all
回
of
来
our
的。
need to continue our work to stop
所以希望
transmission
我
of
们还是能够
COVID-19.
共同努力
I'm
减少
not
病
going to
毒
add
的传
anything
播。
to the modeling today, except to note page 25, which shows
那么
if
他
people
说，刚
have the
才
modeling in front of
王
them,
医
we'll
生
see it
说的
later,
那个
which
25页
shows
啊，我不知道
different
这个
paths that can
25
happen
页，
based on
这个
all of
25
our
页可能就是
activities.
指
Some
如
of that
果
responsibility is
40%、
the health system, a lot of
70%、
that responsibility for us as
60%啊，我们的
individuals
社
to
交
ensure
怎么样
that we？
所以
reduce and
今天
continue
看
to
出来
reduce，
我
infectious
们现在的
contact.
卫
It's
生禁
why
令持续有
the
效
current health
啊，
orders
没
have
有
been
说放
extended.
松。
And why we continue to need to take action in this crucial time as we're developing our immunization campaign and the vaccination campaign in British Columbia. It is very important now.
所以这个大家来讲，这个是很重要的。希望大家啊，接下来的几个礼拜啊，能够被接触的就不要再接触了啊，能够减少就减少。啊，在过去的将来的几个礼拜几月，我们能够好啊，轻轻松松的啊，能够迎接秋天啊，春天
Yesterday, I was asked about immunization in First Nations communities, and I just wanted to give an update on some of the details of that. As you know, we identified a target of 25,000 doses for remote and isolated Indigenous communities by the end of March 2021. It's our expectation that we will meet that goal. Indeed, it's our expectation from the federal government that even those vaccines that have not come to British Columbia in the last short period will be provided and be made up for by the end of March. To the end of February 3rd, which is Wednesday, within that category of remote and isolated Indigenous communities, we've administered 12,800 first doses and 247 second doses for a total of 13,047 doses. Obviously, the reduction in vaccine supply, particularly in this case Moderna, creates some challenges, but we're expecting to achieve our target on the assumption of increased supply in March. Wanted to note as well, and Dr. Henry has talked about this, in addition to the very significant achievement, I think, of vaccination and long-term care of residents and staff throughout British Columbia. Thousands, close to 5,000 essential visitors have also been immunized, and the effect of immunization in long-term care has been positive. There were 49 outbreaks on January 15th in long-term care, assisted living and independent living. Today there are 24, 23 in long-term care and 1 in independent living, none in assisted living. And that shows the progress has been made, and recent outbreaks have tended to be the ones that have occurred in the last 2 weeks have been smaller outbreaks, not the kind of outbreaks that we saw in November and December and the early part of January, which is heartening. That said, we're continuing in existing outbreaks to see the impact on residents in long-term care and their families of COVID-19 and its profound impact in all of those care homes, and all steps are being taken both to support those who have tested positive for COVID-19 and to prevent transmission. And I wanted to say it's very important as well that we finish second doses in long-term care, and we are going to continue to do that so that we can take steps, the other set of steps we need to take following that to allow more access and more normalcy to return to long-term care homes and to the lives of its residents. I wanted to say a couple of things briefly about ski hills, and just to note, and you see this in the material, but it doesn't stand up as well, that Vancouver Coastal Health will be advising later in one of its advisories later today that there's been a total of 547 cases of COVID-19 in Whistler from January 1st to February 2nd. We also saw, and you can see it in the maps, cases, of course, of big white, which we've heard about, and been in communities such as Fernie across British Columbia. The majority of the cases in Whistler continue to be identified in young people in their 20s and 30s who live, work, and socialize together. You should note that to date, 2 of those cases, only 2, have required brief hospitalizations and no deaths have occurred. Almost all of the recent cases are associated with transmission occurring within households and social settings, according to our contact tracing. And we obviously saw a similar increase in cases in November 2020, which was resolved in early December. Actions significant, as you will know from last weekend, significant enforcement actions are taking place at Whistler. I want to acknowledge Dr. Henry and I have spent time, and we're working with the Mayor of Whistler, Jack Crompton, who's played an extraordinary leadership role, I think, in the whole province on this question. I want to acknowledge his work. The industry in ski communities across BC, and the Ministry of Tourism has implemented some measures and will be laying out its full action plan. I think the Ministry and Prince one next week to reduce transmission, which is important because obviously we want to take those actions that focus in on the source of transmission and limit transmission, and not have to take broader action with respect to the entire industry. So I'm very, very appreciative, and I want to salute in particular the work of Mayor Crompton and of people who are working on this file within government, and my colleagues, the Ministers Osborne and Mark. And so that's where those are just a few updates, and just to say that today's modeling and data indicate that the hard work for each of us have made a difference, and I want to acknowledge in particular Fraser Health. If you look at active cases, Fraser Health is approximately 38% of the provincial population, and they're just under 40% of active cases in BC. And this is very different than what we saw in September and what we saw in October and what we saw in November. So there has been significant work done there, and we want to acknowledge that work and the overall reduction in cases back to the provincial average. Not that there aren't still cases, but back to the provincial average there. But this is familiar terrain for all of us. We bent our curve last spring, only to see COVID-19 fight back with all its might. What makes this time different is there's vaccines, and they've started to give the protection to those who we all wanted to get it first and who needed it most, our family and friends in long-term care and assisted living, and those who care for them. But what also makes this time different is that COVID-19 is fighting back even harder. Its new variants have potential to make us sick, make us sick faster, and still cost lives, and still take so much from us. As Dr. Henry has shown, COVID-19 is not giving up, and so neither can we. The message from today is clear. Hold steady in our efforts to stop the spread. Hold fast to the knowledge that our masks, our hand washing, our physical distancing, our work, and our sacrifice save lives, and they do. And always hold on to the certainty that the difference is still down to each of us and the actions we take to stop the spread. Our BC vaccination plan will work. More vaccines will arrive, and more British Columbians will receive their shot. That will take time, and we know what we must do to make our plan work. As we await vaccines and our turn for our shot, our efforts to stop the spread have never mattered more, and we won't let each other down. And with that, Dr. Henry and I are happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon only. Also, please do not mute your phones. You will not be heard until I call your name. We begin today with Juan Palmer, Vancouver Sun.
Good day, Dr. Henry. Thank you for the briefing. Appreciate it. In addition to the 3 variants that you discuss in the briefing, I'm seeing coverage south of the border of what it is being called the California variant.
他又说到了关于病体，他说3个，你刚才说了3个，但是我看到了这个洛杉矶还有一个变异体，我们是不是要关心这个？我们 BC 省要不要关心这个加州的变异体
？A way of catching that if it showed up here in British Columbia.
是不是在我们这儿有了？我们我们有没有你去注意到？他说当然了，变异体里边也有美国来的美国变异体。
One of the southern states as well that arose not that long ago. So these are concerning, and what they reflect is when you have a lot of transmission in the community, there's more opportunity for these mutations to happen, and for them to lead to something that gives that strain of the virus opportunity over others, and so it can start to spread more rapidly. And we're seeing that in LA. We're seeing that in the UK was the first that really alerted us to this concern. So that's why we get fussed about wanting to reduce transmission. You know, we say, well, it doesn't seem to cause severe illness in young people, so what's the big deal? Well, the big deal is that even though it may not make you that sick, the replication of the virus could lead to another mutation or a variant. And we know that these, the ones that we've been concerned about have been introduced into BC, and we're not yet certain sort of how many of them. So every transmission runs that risk. So yes, we need to be concerned about it. And yes, our whole genome sequencing will pick up any of those variants, and there's a international website that puts all of these different ones up there so that we know which are the ones of concern. And there's specific pieces of the, there's, I believe it was 17 different mutations in the UK variant, for example. But only 1 or 2 of those mutations were ones that lead to the increased transmissibility. So the screening test that is being developed at the BC CDC, they're doing it in Ontario, in Alberta as well, and we're working across the country on making sure we can pick up the ones that are of concern, should detect the concerning pieces in the variant from LA as well. And the whole genome sequencing allows us to look at those ones. So we've picked up a huge number of variants across BC, and that phylogenetic tree shows you all the different strains. But that's why we're calling some specific one variants of concern. So the one from LA is still being analyzed by our lab colleagues about whether it does confer this competitive advantage to that virus or not.
Do you have a follow-up one?
Yes, please. I wondered if there is any particular precautions that need to be taken
那么有没有特殊的防范措施，让我们 BC 省对这个因为那些来来回回的卡车运输，对到加利福尼亚来回之间的卡车运输有没有特殊的措施预防措施？他说我们的有一个交流大使就是包括了这个边境之间大家的责任，我们也是。
to have a consolidated program of testing of people who go back and forth across the border regularly. And you bring up a very good point. One of the challenges one of the geographic realities that we live in British Columbia is that we are dependent on essential goods and services from across the continent, and that makes it much more challenging for us to get to things like COVID-0, where people can control who's coming in. There is a lot of traffic, primarily truck traffic back and forth, especially from California. So we are in discussions with the federal government about how do we put in a rational way and hopefully a coordinated way with the U.S. of having periodic testing of people who are essential workers coming back and forth across the border.
The next question comes from Jill Sperling, CFJC.
Hi, Dr. Henry. Thank you for taking my question. Wondering, have you received a proposal from the Western Hockey League for return to play for the 5 BC teams? And would a hub concept with play in Kamloops and Kelowna meet your current restrictions?
The current restrictions, no, because some of the important restrictions we have in place that are necessary right now are about travel and about people coming from different areas together. My office received a proposal early in January that did not meet the considerations that we had in place currently. I know we've received some emails about other thoughts that they had about different types of hubs. Haven't seen that in detail yet, but I am hopeful. This is one of the things that we need to plan for. If things go well during this period of time, we are buying time. As I've said a couple of times, buying time right now between now and the end of the month to understand these variants of concern, to get a better handle on them, now that we have some more restrictions on travel and borders, and to get our immunization program off and running again. So nothing will change in this period of time, but absolutely I want to work with the Western Hockey League so that we can salvage a spring season for them.
主要是冰球联盟呢，它这些计划条件都没有符合我们的要求。那么这个女记者问的另外一个问题就是内陆的有一个医院的6楼都发生了爆发传播的情况，主要是内陆。那么现在跟实际的数据和报道的数据还是有差距。那么现在那边的检测和防疫都在
and there are often concerns that may or may not bear out. So I know the investigation is ongoing, and the people who are doing those investigations, partly the public health team with the infection control team and operations at Island Interior Health, are actively managing every single concern in that hospital.
Thank you. The next question comes from Justine Hunter, Global Mail.
Hi, thank you. The exposure of the variant is still in BC is still low, but we've got limited capacity to do the screening. I know you said you're stepping up surveillance. I just wondering if you could walk me through exactly what that looks like.
那么他也是说到了变异体在我们 BC 省的数字现在还少，但是你说过了要加强检测，特别是这些跟踪接触工作以及基因检测工作。那么你觉得我们这个阈值，你觉得你的这个数值是在哪里？到了哪一个值才能够加强？那么他说核酸检测这是我们的过程，每一个阳性案例都要做核酸检测。
Talking with Dr. Krajden about pulling that together, and they are moving ahead with that one, so that should happen very quickly, and that will help us target the whole genome sequencing. We're also increasing our capacity to do more whole genome sequences. It takes a lot longer to do them, and there's a delay sometimes. So part of our surveillance is trying to ramp up our screening lab test that helps us identify which are the ones that are likely to have these variants of concern, or at least part of them. So that's one phase that we're doing. We're also very targeting more concerning outbreaks, spread in communities, and people of specific age groups. We've been focusing on ensuring children of school age, for example, that we do oversample and do whole genome sequencing on people who are positive in that age group, and of course anybody who's positive from international travel. Along with that, on the public health side, we are doing more intensive follow-up around people who are identified as having one of the variants. So that means testing in all of their close contacts where we might have said only to get tested if you develop symptoms, making sure that people are more effectively isolated. And this is another place where the actions that the federal government are taking to ensure that people are maintaining quarantine and are being tested at day 7 and day 10. So we're doing the same thing when people are tested prior to coming out of quarantine if they've been exposed to somebody with a variant. And things like the additional testing that we're doing around even non-close contacts, for example, the school
那么对这个没有亲密接触的这个，主要是我们飞沙卫生局，主要是对学校，只要没有亲密接触的，也在扩大测试，主要是在飞沙卫生局的学校里边。
Under the plan that had been rolled out a couple of weeks ago, there was the expectation that, for example, seniors in the community would be getting calls from their doctor maybe in mid-February to try and book their first shot. So I'm just wondering if you can give us an update on what people who are kind of next in line in that second phase.
那么他也是说到了，有些老年人的医院都是接到医生的电话，到2月份中期会打，但是现在的疫苗供应情况有变化。那么现在是怎么办？这些接到的电话，那么没有办法按时打，你怎么办？
And we are putting in place, so it's more the 1st of March. People who are 80 and above in the community who have not yet, a proportion of those people are people who live in care homes, long-term care assisted living. So yes, we are putting in place a couple of things. So it will not necessarily be your family doctor who will call you. We will be connecting with people in a number of ways. That is currently under being worked out. So we're using what we know about people by age and their MSP, for example. To connect with them, Service BC is working. We're setting up a hotline so that we can call people, and there will be much more information in the coming weeks, probably the week after next, very detailed so that individuals, their family members, our community members, we can support everybody in booking an appointment, making sure we know people who cannot get out for appointments, and we'll be going through places like assisted or independent living homes to connect with people who are in those settings. So that is something that Dr. Ballum and her team are being put together right now. So please be patient. We will have much more information about this, both through the public, to people directly, through your care providers, through community groups, to connect with our elders and seniors and get them immunized as soon as we can. And the target is to be starting with our mass clinics as soon as vaccine is available in March.
Thank you. The next question comes from Richard Zussman, Global News.
Dr. Henry, we've heard you refer a few times to the end of February. Can you give British Columbians sort of a deadline of what you are looking for over the next few weeks in order to ease the restrictions? Is it a certain number of cases? Is it a certain number of variants?
会这个放松这个禁令，那么你现在能不能给我们一个期限
？So yes, I will be looking at are we on a continual down?
因为现在变异的这个情况还是未明，还有零星发生，社区里边我们还不了解这个社区里边零星怎么发生的，所以我们要看到了阳性率是很重要，我们要看到了重点地区的爆发的情况，我们也看到还是变异体在爆发在传播
，so it is all of the above,
所以这些都是我们要考虑的，
考虑的因素。To be able to protect those who are most at risk in the communities. 所以我们一定要保护社区里边最脆弱的人，所以这些措施不会变，到2月底之前不会变。他没有回答这个记者说的那个你有没有给自己最后期限？就说到哪月几号我不再放松了，我就放松这个期限。
And there seems to be a broad deadline here, but nothing specific.
Yeah, so
那么他说了是，就算你没有一个特定的日期，那你有没有这个期限？不是说我不需要你说3月1号、2月1号。
What I'm saying is,
但是我想说的是，我们在看我们所处的环境
uncertainty, and that we need to buy some time to understand if the positive things that we're seeing are going to allow us to increase some of the take away some of the restrictions we have in place now
那么现
and
在
be
看到
able
了
to
我
do
们这
that
个限制的
safely.
更多的
So we
他们
don't yet
更多的限制
know
措施了之
what
后
that
他
is.
们是找
And
正面
that's
走
why
的
I'm leaving it open-ended.
所以
I'm
我们
not
现在
putting
没有
an
把
end
这个期
to
限给
the orders that
缩
are in
死
place now,
都不缩
but
死
I will be continuously reviewing the data that we have to see if we can do it earlier than the end of the month. But I want people to start thinking about it's not going to be yay, we're out of this, we're back to normal. It's going to be, can we slowly and thoughtfully find an increase in those social connections that we all really want, and some of the activities that we've had to curtail because of these risk of transmission, and do that in a safe way in the coming weeks. And much of it will depend if we start to see, I hope we won't, we start to see one of these variants take off, then all bets are off, and we may need to actually increase some of the restrictions that we have in place. I don't want to go there, but right now we need to buy that time to understand, to stay the course, so we can, part of getting immunization going again is really important to protect those who are most at risk, and that gives us a bit of buffer. People call it hardening the vulnerable. So that is something that's part of it as well. And I think we will be making good progress in the next couple of weeks, and if we can, we'll take off some of these restrictions earlier. So now's the time to prepare for how to do that safely. And I think if we look around at jurisdictions around us in Alberta and Ontario, Quebec, they are actually looking at lifting some of the restrictions to take them to a place where we are now. So we need to put that in context too. I want us to continue to be able to safely go to restaurants, to safely go to retail shops, to safely go to our hairdressers and other important businesses in our community. But we know that it's also important that it's not health or business, it's both of them together. To safely go to ski hills. So now's our period of time where we have to put that in the context of the risk that we're facing from some of the things like having these new variants on the horizon and being able to get second doses of vaccine into the most vulnerable in care homes. So that's about as specific as I can get right now.
Thank you. And the next question comes from Binder Sajjan, CTV.
Hi, Dr. Henry. I'm just wondering, given the delays we've seen in the vaccine rollout, you spoke about how vaccine is back-end loaded. We'll be getting lots more in March. How big of a concern is that in terms of starting to slowly ease these restrictions, and what do you need to see there?
Yeah, I need to see more confidence that the actual vaccines are coming. Our strategy was rolling out nicely, and it's been stretched out and delayed. So we need to be sure that we actually are getting the doses to meet those needs that we have. It is becoming more important to we're realizing that the second dose in elderly people, for example, is probably an important measure, safety measure to have in place in care homes. So those are some of the things that we're looking at. Just getting more confidence that the vaccines that we expect will be coming in time so that we can get our program up and running. I also, in the next few weeks, we should have additional vaccines available. So we're still in that limbo period waiting for those. So having a better understanding of when additional vaccines might be available and who we can target those vaccines to is the other part that we'll be balancing as well.
And just a reminder that the core of our vaccine program so far, and you see its impact in long-term care already, and we expect it to continue to have that impact. But the core of it is to focus on vulnerable communities. And those are our priorities. That's what we set. That's what we laid out in our plan, and that's what we're proceeding with, albeit with less vaccine, more slowly than we would like. But the expectation on that plan right now, Dr. Henry just talked about other vaccines in addition to Moderna and Pfizer that may come, is about 10% of the population by the end of March. the vaccine that we expect to come from the federal government.
到了3月份的时候，我们计划是我们整个省的人口的10%都能够接到疫苗，接种疫苗。这个也是希望我们的这个联邦政府能够朝着我们的总的目标是到6月底50%的人口都能够接种到疫苗。那么我们一定要保护好这些最脆弱的人群。
But we need to recognize that in the short run.
那么同时我们也要意识到，在短期里边，我们一定要维持我们现在的所有的行为然后来减少这个病毒的传播。那么这样的话呢，才能够保护好更多的脆弱人群这个保护好我们的卫生机构、医疗机构，直到我们有更多的疫苗获得到达。
Do you have a follow-up, Binder?
I do. Minister Dix, I wanted to see if you could expand a little bit on what you were saying there about Whistler. It sounds like there's more perhaps restrictions or there's a safety plan coming. Can you talk a little bit more
也是对 Whistler 的滑雪胜地你们有没有更多的卫生安全计划措施限制措施
living together. And just wondering if that means that there could be some sort of an isolation facility opening there.
I think, and Dr. Henry will speak about that, about the issue of transmission in a second. I think it's important that we understand that. But I think that already last weekend you saw 61 inspections by WorkSafe BC, significant, I think a couple of dozen inspections by environmental health officers from Vancouver Coastal Health. So that work is happening. Right. One of the places we're seeing transmission is in social gatherings and social settings around Whistler. It's not skiing on the mountain that has been the principal source of transmission. So what we're doing is continuing that, increasing, and you'll see, I think, an increase in communications, and then more details of a plan, both from the industry involving health authorities, but also the Ministry of Tourism, to target transmission and to reduce transmission in the coming weeks. I think it's very important that we do that.
所以对我们来讲，促进旅游也是的，但是主要的问题还是减少传播一定要这个一定要看到每天的新增案例我们博医生说那个500那个1月份到2月份每天那边新增我明定每天我们 BC 省都是500。
At Whistler, because it's 547 cases in Whistler, remember. There may be other cases of transmission that are reflected in the place of residence of the person who tests positive with COVID-19. This is significant. It's also significant in Fernie and other communities around BC. So we have to take these steps now. I know the industry is very interested in doing that and involved and active in the plan, as are other parts of government. So we have to take some steps to focus on, make those workplaces and those communities safer, and the municipalities, I think, are doing a very good job, particularly Whistler, in engaging in this, and we just got to keep doing it because regardless of the nature of the transmission or the seriousness of the illness, that's way too many cases.
像 Whistler 之类的滑雪胜地1年也就靠这个季节在挣钱很多人靠这个旅游业在工作在生活
Whistler, Fernie, and others. And yes, there are already places in hotels and other places where people who are infected can safely isolate without infecting others in their household or in their communal living setting. That's been in place with Vancouver Coastal for some time now to help support people who are infected. But the other thing that we've been saying for some time as well is stay local. And for Whistler, that means day trips only. Right now is not the time to go up there and party. And that is important because the community needs to be protected from us, and we need, if we're going up to Whistler, not to bring those things back, not to bring the virus back with us to our community. So staying local is one of the important things that we all must do around the province, and for that, day trips is a good proxy for that. I know that means that there's a broader community that can do day trips up to Whistler, and that means they need to check ahead to make sure that there is space on the mountain. That's another issue that we've heard has been a concern, and I know the community is looking at how they can support that too.
就他的意思也能不住宾馆就不住宾馆了，这个很清楚了，就是 one day trip。他说我们很多的 communities 到 Whistler 就是 one day trip。
hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this morning comes from Marcella Bernardo.
Hi, Dr. Henry. I just heard you say that partying up at Whistler is not a good idea, but day trips are still okay. And we've been hearing
看到了啊，就是我也是这个问题了。他说一天的来回是 OK 的，但是你是说了不能快市这个跨市的，那Whistler那边已经快600个例了，600例了。那么这个你是不是有点给人家的混乱？你的建议是什么？
Something that has been brought up to this industry group as we've been talking about. I know they're coming out with a plan. I expect it'll be next week. That is one of the concerns that has been brought to their attention. And I know the community is very concerned about that too.
也是在焦虑关于安全的问题，同时呢也是经济发展的问题。那么有什么特殊的特殊的安全措施包括那个让人们不要去看电影，不要去教堂。那么现在又是多到旅滑雪胜地去，怎么又 OK 呢？这个记者问的真的好，所以记者就是要问他们，一定要让他们难看你说了滑雪是 OK 了又说不能去看电影，不能去教会
And that is where we're seeing transmission happening in several communities.
我觉得再解释都是苍白的，能不去滑雪就不去滑雪，没有什么。他说 visit 不要去度假，去 visit 这个就是苍白的。他说了我是说，他说我们那是visit not vacation。vacation 就是度假，可能要包括住吃住那么 visit 就是纯粹去看看。那么他也是说能够待在本地就是待本地。那么各位观众，那么今天的这个本省的 BC 新冠疫情模型分析以及这个答记者问就转播到这儿。那么下星期一还是有新闻简报，欢迎大家到时收看，也祝各位网友周末愉快，也是说 stay health 让我们一起就是还是安全的大家也是春节马上要到了，也祝大家这个新春快乐。昨天是小年夜所以现在也流行什么小年快乐对我们南方人来讲呢，小年不知道是什么意思，反正我们也就是随波逐流，在这里也祝大家小年快乐。